do promotion, especially we start from May 28th, where it's International Menstrual Hygiene Day. We call it as MH Day also. So on that day we do advocacy program, and we include both the boys and girls also, and we teach the girls, especially the girls who are undergoing the first time period menstruation. So we teach them how to take care, how to keep them hygiene, and through that one the promotion is being done. We have lots of facilities compared to the olden previous year. Now we have changing room in our girls toilet also, where the girls can change freely. Both all the facilities are available there, water, soap, even the towel also, and we provide them with sanitary napkins. Other than that, we have the education part where we help them how to keep them hygiene, how to take care of themselves when they are undergoing menstrual. Some girls, they really have this cramp, they get pain during period, so we help them how and what to do when they are undergoing menstruation time. Sure enough, there are girls who feel shy, they don't open up and they hide to especially from the boys and to the teachers also. And then some of the girls, maybe in the past we have cases like where the girls miss their classes, they don't come to school during period time. Then as in the first question I have answered that through this program, the advocacy and promotion of menstruation hygiene, it has the girls are coming forward for this one, but still we do have one and two who feel shy, who does not open up. So these things we help I mean giving them friends from their own peer in their own class, and then also we talk to the boys and tell them that do not tease the girls when they are undergoing menstruation. And then sometimes we notice that they just say they are having stomach ache, back ache, and then we directly ask the question, are you undergoing menstruation? Do you have any problem with that? So being a lady, we do know that the girls are undergoing menstruation and they don't open up, they are feeling shy, but when we ask them the questions directly or alone, then they open up. That time we help them. So what is your problem? How are you feeling? Do you need any help, like that? So this way some of the girls are being helped, but compared to the previous years, many of the girls are coming forward now, and then even boys are there who support them. As we can see, the parents are supportive. I think they are also part of the community. The parents are being supportive, because especially when the girls are having the menstruation, we do get calls from some of the parents that saying that their girl is undergoing menstruation. If you can consider her, especially from the HP classes, where they have the outside class activity, and then other when we have program where it is outside the classroom. So we do get calls from the parents that their girl is undergoing menstruation, can you help her or excuse her, like that. So this way the community is being helpful, but generally I don't know about the other community, but parents are there to support it. So the parents are also aware, and girls, though being very young age who is undergoing menstruation, they are being supportive to them. And the elder ones, you don't have to say them, they are already aware of all the programs. It's just superstitious, or we can say the myth where the olden people used to follow that. But menstruation is not something where we can avoid it. It's a natural, it's a part of human nature. And the girls who menstruate, they should feel proud that they are undergoing menstruation and they are ready to become a mother. So reproductive part is being active there. If menstruation does not take place, then something is wrong with the girl. But if menstruation is there, then they should feel proud that. So there shouldn't be any bias or like superstition being that they should not enter the altar, or they should not mingle with the boys or something like that. So we have no stereotypes out here in our school. If they are healthy, if they are ready, we allow them to take part in all the activities, where we don't say that, okay, you are undergoing menstruation, please avoid this one, don't go for the prayer, or don't attend this class or HP class, like that. But if they are really in pain, or if they really feel uncomfortable, then we consider them. Otherwise this superstitious or stereotyping or the myths we don't teach our children also, and they don't, I don't think they don't believe in all those things also. So all the girls are allowed to attend any type of activity.
So the town anyway so Tetlin tribute the shibin that Chidangira Shibita. Hakang Nale Gyonghang Yusadina Luchim Sumotumidi, Zoom Machomijum Sedeani. Kachum Sochi tip the lieutenant gave a chuchum sulu, Tetlin Kungi Zetting, Kungi Nubodus, Nunigi Yakaleshebe, Chijum Sanu. Telen Ching at Dugia Kabdinalu, Gyong Haportu Gyonghanalu Zutam Michu Seki, the Ani Chi, Ani the Tokbody, the Carlo Chi Tati, Kachibina, Pebagiti Mizem, Sinachuka Hamna, Kachibi Gyonghana Zutamashivinas, Kunkachuakase, Tanzumgi Tiwalashon, Tani Umidi Kun Inchi Minchit, Jasa Jatamberko watching Gumbo Gudus in Apollo, Makala Gudus in Apollo. That is to me, Machi Tantric Disungachi, Cassia Totobe, Nangachi Shatamishu that day. Moma practitioner Jim Jochibasachi, Moma Yamlim Bemichim Jochibasaching a Shatachu, the Motochubugi, a Sichim a Shatamishu. Tani Bodalu Hum the Gumigi Gudusuna Mataudalu. Amsud Aluchabi di Amsugi Alum Pona Motochubi Pogana Aluchabi swim in the bar. Tani Chabdalu, Tetelin Pona Yumigi. Aludi Yanchimachin Melom Lokbata Tapsum Yanchimachin Tembichi Dazum Bachin Tetan Chujong Dusugi Nuturgibe Amsudus Madapulera Worm Salamena in Genalo Aluginil Alushasini the Mapaler use mebe Lalentamo to Barcamtani Nuevo come down to Yuvita Tani Benedige the data Umikaina Tamnum Yumikaina Mimikaina Nachigi the Chimasubdalu the general because I mean, just a monsieur is a Kakumijum sedan to give me. Danny Benedigal, Hakang Gyonghang, that Tarnabagi at Sitele Teleba, Midisugi 2, Dams of Data Malichu Pimito, Choshana Zumitus, Telangachigi, Chushogi Lab, Bemitus, Migi, Labanuma, Tessuradime.
There's no hard and fast rule, but as long as you feel it's uncomfortable, at least you should maintain the hygiene. Now it depends on the economic status. Okay, there are lots of commercial products available, but the basic requirement is you can use clothes which is usually cotton and should be clean, properly dried, and should not be contaminated, can be used. But there are lots of sanitary pads which are commercially available, can be used, but there are now tamponettes which are available, but usually we don't recommend because of the risk of infections going into the upper part of the genital tract, and which can cause toxic shock syndromes, infection. So we usually don't recommend tamponettes, but if you can maintain the hygiene and properly keep it clean, even now women can even use menstrual cups. But the problem with a menstrual cup is that you have to maintain sterility, you have to boil it. So, but there is no hard and fast rule that which is better over the other one. But the basic message is that anything that you use, preferably cotton, should be clean, dried, sun-dried, and should not be contaminated. No, you should never do that. Because if you try to clean, because upper part of the vagina is usually sterile, otherwise you will have an ascending infection. Ideally, you should not be using any intimate hygiene, this commercially available. But if you use, it should be usually in little bit on the acidic side. So because normal vaginal pH is around 3.5 to 4.2 to 4.6 ohmiol. Ideally, you should not keep the pad for long duration, because if the pad is soaked, then it can cause irritation of the mucosa and the skin. But ideally you should change after 2 to 3 hours. And if you keep a sock pad for long duration, that might cause erosion and abrasion of the skin, and it will be really discomforting to a young girl or a woman.